When we talk of universal health coverage, we have a pioneer with us. Actually, Dr. Recep Akdag from Turkey has managed health transformation within the system of Turkey in his role as Minister of Health, as Deputy Prime Minister, and now as Member of Parliament. Welcome.
Thank you very much.
Dr. Akdag, your experience that you shared with us in the meeting in Salalah here in the Sultanate of Oman was extremely interesting. What were the main elements needed so that other countries can learn from the Turkish experience? What were the main elements, in your opinion, that helped the transformation in the system?
The first element was strong commitment of my government and my Prime Minister also. Without that kind of support, it is not possible to change anything.
Can I ask something? You were Minister of Health. How did you lobby with the Prime Minister to make this a priority? Because that takes a lot of work on the part of the Minister of Health.
It is an excellent question. You have to have some evidence-based data and show the data to your government and to, of course, your Prime Minister. And as a Minister of Health, you should create a kind of two-point approach and make some quick wins. Then you, gather the support of the public.
All right.
And at the same time, support
the policy leaders as well. Okay, so you needed both support, but you also had to have data. And to have data, collection of data, you have to have good budgeting as well.
Of course.
To budget, so that the Prime Minister would see the result that he would benefit from as well.
Yes, and what we did for the budget side, we merged all the social security policies under one umbrella, and we created just one national compulsory health insurance system. Revenues from general budget and this compulsory fund helped us to finance the whole system.
Can I ask another question? Did you go in stages? Did you go all Turkey at once, or did you start with several governorates and then you went to scale?
No, we did it at the same time.
At the same time?
Otherwise, I strongly believe that it is not possible to make a real transformation.
Unless it happens all at once.
Yeah, because some lobbies, some, external powers will
all try to fight you.
Start to fight you. So you have to be very fast if you really want to transform health system.
Okay, another question, Dr. Recep. What was the major challenge you faced? Who were the ones who opposed you most, or what was the major challenge? Was it people? Was it money? Was it methods of working?
Especially some behaviors, some traditional behaviors.
Okay.
There was a kind of
resistance
practice for our physicians, our specialists. They used to work privately and publicly together.
Okay.
It creates a kind of conflict of interest.
And you stopped that?
Yes.
Whoa.
Gradually. We started a kind of performance-based system in our public institutions, hospitals, and then we offer our physicians, specialists to select, one way or other way. If you really want to
private practice, you're on your own.
Yes,
if you want to go in the public system, then you're in, but you can't do both.
We split it, these two practices. It is very important. Otherwise, you can't increase the efficiency and effectiveness in your institutions, in your hospitals.
Okay. And when you became Prime Minister, you also supported the program.
Sorry?
As Prime Minister,
yes.
You supported the universal health coverage very much, of course.
Of course. Otherwise, as I mentioned before, otherwise it wouldn't be possible.
Okay. Dr. Akdag, we thank you very, very much. You've enlightened us with these very specific measures that have to be taken.
My pleasure. We are brothers, and then I believe that if we get our powers together, all the countries in the region can reach universal health
So the Salalah meeting will have a big push.
coverage. Yes, of course.
Thank you. Thank you.